Hello everyone, my name is Dr. Patrice, a specialist obstetrician and gynecologist. I'm currently pursuing my master's in global public health, and today we are diving into one of the most pressing health challenges of our time, HIV prevention. As a medical doctor, I have seen firsthand the impact of HIV on communities across the globe. In today's episode, we have with us a teacher, an advocate, a researcher to talk to us about HIV prevention in Africa. He is Dr. Fernando Ngoji.
Thank you, Patrice, and thank you for having me on the show. Let's do it the African way. You have to shake, like where we come from, you really have to shake.
Yeah, thanks for making time to join me today, Dr. Fernando.
You're welcome, thank you. Yeah.
So, Dr. Fernando, can you briefly introduce yourself to the audience?
Yeah, as Patrice has said, my name is Dr. Fernando Ngoji. I'm a Kenyan medical anthropologist I'm currently working here in the Republic of Ireland, in this part of Europe. Mostly my work revolves around, how people adapt to new technologies and how the users can actually co-create to come up with systems that work for them. But I'm specifically focusing on HIV prevention technologies, and mostly at the last mile. Like when you look at the supply chain of HIV medication and also the services, there's this last mile, which is normally the most critical part of access. So that's where my focus is. Apart from being a researcher, you already talked about it, I'm an activist, I'm an advocate, I'm a person who believes that, when interventions are out there, they should actually get to the people and really help the people. You see, if there's a medicine that cannot be accessed by the people, then that's not the right thing. So that's what I do. Like, that's me, that's my life.
So moving to our next question, let's talk about the challenges that face HIV prevention programs in Africa. Most of the times we see a lot of NGOs who come and drive in big cars, but we don't really know what they are doing. So what are some of the challenges?
Yeah, so the very first one is, it's very important to involve the gatekeepers, for any program to be accepted. Yeah. So some of these programs were actually not accepted because they're designed at the ivory tower and implemented in the grassroots. I remember, for instance, in Kenya, when PrEP was being implemented, there are lots of myths and misconceptions about PrEP that was coming from the gatekeepers, not even the users themselves. Like, oh, now that you're bringing this magical pill, will our girls be promiscuous? So the priests, the local politicians and all that, and they were justified because they were not involved in the process. There was no this public consultation and, getting to educate people about this. So the lack of understanding why this intervention actually needs to be, that is a big problem. Then the second thing is there are other competing needs, like in terms of infrastructure. Let's say there is education versus, ART is there for treatment, but it takes another infrastructure to implement, let's say, PrEP, the long-acting injectables, for instance, because you need to train healthcare workers, but do governments really have resources to do that? Some of them don't have, because there are these competing needs. Do you train healthcare providers in this new intervention, or do you train more teachers, or do we divert more funding towards maternal health vaccines, or do we put more money on malaria and all that? That is a challenge, because now it's just there are more prevention tools that are coming in and prevention efforts coming in. But also, as HIV as an issue continues being a problem, there are also other, like cancer coming up, and other competing diseases, even very small things like snake bites, like in Kenya, might be a problem, because now these are other needs that come up and they're competing, Yeah.
So these are really serious challenges, and as we said before,
and donor funding, when they withdraw, money because of a reliance on donors. They withdraw money, the programs collapse.
Oh, okay. So there has to be a system to sustain
Sustainable.
all this. Are there any promising new vaccines or treatments that could drastically change the landscape in HIV prevention?
Yeah. The new, the in thing now is more of long-term, long-acting choices, because one of the biggest problem with HIV is taking a daily oral pill that causes treatment burden. Pill burden. Taking pills, sometimes you forget. It takes toll on most people who actually drop out of treatment is because of that. Then the second thing is also the stigma associated to taking some medicine every day. Even if people know you are taking medicine every day, even if it's not for HIV, they'll still think you have this big disease and you're going to die. But these long-acting injectables, these are game changers, both for prevention and also treatment, because they're discreet. They're easy to adhere, because it's just an injection and you'll have to go back after a certain period of time, get injected, and But the biggest one is that HIV vaccines are also in clinical trials. Like, that will be a game changer when it comes. I don't know if you will be among the first candidates to go for it. Yeah, but it should be something that actually, in future, if it works out, just like the measles vaccine, everybody should be, vaccinated.
And there's also this perception that HIV vaccines have been delayed in its development because it affects Africans and poor communities. As we have seen with COVID, within a twinkle of an eye, we had vaccines.
Yeah, because it affected everybody.
So this conception comes to be true in that case.
Yeah, I will say, I don't understand the politics of HIV so much, but it's something that you can argue like that because of the inequalities within the people who are infected. When you look at the countries and how HIV infection is distributed, then you can argue that.
Okay, nice. Okay, so that takes us to our next question. And how important is international collaboration in the fight against HIV in Africa? And what are some of the successful partnerships you have seen?
Yeah, research and development is key. That is number one. The classical one was donor funding, because most of the money, like PEPFAR, USAID, and money from the West, supporting HIV programs in lower and middle income countries. That is a good connection, But right now, again, it comes to training and research and development. You see some of us who come here for training and we take back this knowledge back at home. We continue the research and also the contribution where the lower and middle income countries don't just receive, but they also participate in the development of the new interventions. That is another thing. Then the very last thing, and this is why it is very important for collaborative efforts, because the world has become very small. Gone are the days when it took you 30 days from, Mombasa in Kenya to, let's say, even down south, Cape of Good Hope, because you used a boat and all that. Right now, you can have dinner in Dublin and you have breakfast in China, because the world is becoming small and very soon even smaller. So then what does it tell you? That the virus will become more mobile, and whatever affects a certain region, it might not be contained only to that region because of the movement that is easy right now. So even for the virus, it's so easy to spread. So if the virus affects continent X, then it should be a global collective effort to make sure that they contain the virus, rather than saying it's their problem. You see, like COVID, we say, okay, say it's their problem, but You jump on a plane, you take COVID down there, you take COVID to the left and the right here.
Yeah, and I think to add to that, we've seen a lot of collaboration from WHO, as you mentioned already, PEPFAR, UNAIDS. We also have the UADP, UNICEF. We've seen successful collaboration with other governments and institutions, and these are successful ones we can mention. And you spoke about international collaboration. How do you think governments and NGOs could collaborate better to fight HIV?
I think working on a sustainable model. Yeah, because if it's an NGO, we can't have an NGO just supporting something like, forever or for good. The government should actually work collaboratively with NGOs to come up with sustainable models of fighting HIV, either through advocacy or through infrastructural funding and training and all that. Because instead of you train and hire, like this is what happens in some countries, an NGO trains and hires these medics, they work in this particular area. Then once they run out of funding, these people who are highly trained cannot be hired by the government. Okay. The government has already hired their own staff on the side. Okay. So then they need again to train them so that they know how to, like PrEP for instance, they need to train them so that they know how to implement the intervention. So these collaborative, sustainable models are needed for continual efforts towards fighting HIV.
Wow, thank you. That's very insightful. And that brings us to our last question. And we've mentioned PEPFAR, which is one of the greatest US President's initiative. Dr. John Nkeka-Song, a Cameroonian, was appointed in 2022 as the new head of PEPFAR, that is US President's emergency plan for AIDS relief. He's also the first person of African origin to lead PEPFAR in its 18-year history. What does this mean for Africa, now that we have someone from the continent?
I'll give you a very African answer. That if you vote in a politician and they go into government, for instance, a politician from your region becomes the president, there's always the assumption that we will benefit.
Yes.
Yeah, we will benefit. But you see this person is mandated to serve the entire region, like if it's, that name is normally different case, so Nkeka-Song is normally very I choose not to pronounce most of the time. So for him, number one, he has a global mandate. So then me as an African, I put my expectations down. But being in such a position, then he understands the African problem, especially around HIV, from an insider perspective. So I believe, like when it comes to programming and all that and priority areas, it's easier for him actually to understand which areas need more effort and another one that does not need more effort. Number two, we have somebody who is, it's within part of your networks, like your country's network. So then it's easier to reach to such kind of people to tap their expertise and also for global connection and also such kind of collaborative efforts that you are talking about. That is all I can say as, my thoughts on that.
Yeah. I think this also brings into memory when Barack Obama was elected president of the US.
The Kenyans, we were very happy.
Obviously, Africans, and Kenya in particular.
Kenya in particular, that was a pickup line. If you meet a white girl, you tell her, we can make an Obama in the future. Because Obama's father was Kenyan. So we were happy about that, but did it change anything?
It didn't change much. But we have high hopes on Dr. John Nkeka-Song. So hopefully we will see the benefits of his appointment, not only in Africa, but globally. I want him to be a success. And thank you, Dr. Fernando, for making time for this great discussion. And I hope it has benefited our viewers. And I expect to come up with the next episode on HIV prevention and pregnancy. Thanks everyone for being with us, and I'm looking forward to our next session. The fight against HIV in Africa remains critical, but with continued efforts in education, access to healthcare, and community-driven initiatives, significant progress can be made. Empowering individuals with knowledge, expanding testing and treatment, and reducing stigma are key to preventing new infections and improving the lives of those affected. Together, we can work towards HIV-free generation in Africa. Thank you for joining us in this important